This video describes how one can draw information from your Encounter Assistant for your fracture program. By going to the search, then fracture, bone health program, you will see here that the search is meant to be a demonstration search. It is only pulling information from fake patients. Let's perform the search. If your program had adopted the Fracture Encounter Assistant and the Post-Fracture Encounter Assistant tool number 30 and 31, this search would draw the following information. We see here that the names of our fake patients appear, and then we have the type of fracture, whether they're hip fracture, spine, wrist, pelvis, or shoulder fracture. We see here by clicking on the header, we can align all of the patients who had wrist fracture or who had spine fracture. We can also see who had a repeat fracture, and we know that patients that had repeat fractures are at high risk. We can see if the patient was on osteoporosis medication and what type of osteoporosis medication they were on. We can see when the last bone density was done and if a bone density was ordered, and here if the bone density was corrected in view of the fragility fracture. That is if the user had done tool number 25 or 27. We can see if there was a lateral spine x-ray that was done and if there was blood test ordered. What can we do with this information? We can draw information into an Excel sheet and obtain good visual information. So we see here that the type of fracture, the most common, is our wrist fractures. And we can also see that the activities that were done for the patients. So we have here 7 patients and all of them had a bone density done. We can also draw the information per patient. We see here that patient number 6 only had a lifestyle review. This patient would be called back to do more of the best practice activities.